Hello everyone, here I'm back again with the video for Scapula. As I already told you, I had my exams till 16th, so if I have been delayed in uploading video, I'm very sorry. And today we are going to talk about the second part of the scapula as I already promised, and that was the features and attachments of scapula. But I have modified it in a little more better way, and today we are going to talk only about the features of the scapula rather than talking about both features and attachments and clinical anatomy. Now, why? Because when we go through each topic thoroughly and clearly, it'll be easier for you people to remember it. So, in the last video, we went through the side determination. That is, how do we determine the side, whether it is the right side or the left side of the scapula bone. And in this video, we are going to talk about the features of the scapula. Okay, so let's get started. Scapula is a bone present in the posterior of our body, posterior aspect of our body. And then when we go for the features, it consists of 4 features mainly. The first one is your surfaces, borders, angles and processes. Okay, you remember it as SBAP. Okay, so surfaces, borders, angles and processes. Okay, it has 4 things in total, and here only you have most of the muscle attachments. See, when you're very thorough about the features of the scapula, then only you would be way more easily remembering the attachments easily and very correctly. Okay, so it's very easy to remember. See, borders, angles and processes, all the 3 are 3 in number except for surfaces, which are 2 in number. Okay, so now let's go through the features with the help of the scapula bone. Okay, we already know that this is the right side of scapula. Now first thing which we need to know is surfaces. It has 2 surfaces in total, the costal surface and the dorsal surface. This is also, the costal surface is also known as the anterior surface, and then you have the dorsal or the posterior surface. When you see the costal surface, the feature that the costal surface has is longitudinal ridges. See, it has 3 longitudinal ridges. Okay, and the 4th one is getting merged with the lateral border and it looks like your rod. Okay, so the costal surface shows longitudinal ridges and it is concave. Okay, see, you can see it is concave this way. Then we go for the dorsal surface. When we see the dorsal surface, the first thing that we will be noticing would be your triangular spine. This is also known as spine of scapulae, right? So this spine of scapula would be present in the dorsal surface of the scapula, which will be dividing the dorsal surface into 2 fossae. That is your supraspinous fossa and your infraspinous fossa. Okay, that is about your surfaces. So as I told you, we can remember the features as SBPA, right? Sorry, SBAP according to your convenience. So we have gone through the S, that is the surfaces, and now we will go through the borders, that is the B. I told you, except for surfaces, the border, angle and processes all are 3 in number. So we will go for the borders, which are 3 in number. They are superior border, which is thin and small, thin and short, you can say. See, this is not very lengthy, it is a short superior border. Then we have medial border, this one. The medial border is thin. Okay, and then we have lateral border. Lateral border, how you will find the lateral border is, it bears a glenoid cavity at the upper part. Okay, and it looks like a rod, it's very thick. So lateral border is thick, medial border is thinner than the lateral border, and superior border is very thin and short. Okay, so now if we go for the next thing, the superior border presents a suprascapular notch. This is a notch which is known as suprascapular notch. So the superior border presents a suprascapular notch, and the lateral border presents a infraglenoid tubercle. This area is known as infraglenoid tubercle. That is, infra means below, glenoid means below the glenoid cavity, and it is a tubercle. Okay, an outcoming kind of surface. So infraglenoid tubercle. Okay, that is all about your borders. Then the third feature is your angles. We have 3 angles in total. Okay, the superior angle, the inferior angle, and the lateral angle. Okay, so first we go for superior angle. The superior angle is covered with the trapezius muscle. Okay, the superior angle, this angle, okay, this angle, the superior angle is covered with the trapezius muscle. Then if we go low, the inferior angle, this angle, inferior angle, is covered with the latissimus dorsi muscle. And when you go for lateral angle, see, lateral angle is also known as glenoid angle because it's bearing a glenoid cavity. So lateral angle or the glenoid angle. Okay, that is all about the angles of the scapula. Now we are going to go through the fourth feature, that is your processes. There are 3 processes of scapula. Then this is very important to remember because it has some external features that are always asked in Viva, and they also have some attachments that are usually asked when you are going for your practicals. Okay, so I told you there are 3 major processes. There are 3 total processes. First one is your coracoid process. Coracoid process is a Latin word which means crow beak. Okay, it looks like a crow beak, or it also looks like a bent finger like this. See, it's looking almost similar. So this is the coracoid process. Okay, and when you go dorsally, in dorsal surface you have 2 processes, the remaining 2 processes. First, we have used this name so many times in all of the scapula explanation, that is your triangular spine, which is also known as spine of scapula. Okay, this part from here to here, this is your triangular spine of scapula, also known as spinous process. And the third one is continuation with this one only. Okay, it will be continuing with this part. This one is known as your acromion process. Okay, if we go again, coracoid process, which is beak-like, crow beak-like or bent finger-like. Posteriorly, spinous process of scapula, and then this part is your acromion process. Okay, this acromion process forms your acromioclavicular joint. The coracoid process forms your coracoclavicular joint and also coracoacromial joint. Okay, so that is all about processes. So as I already told you that processes are very important from the point of view of practicals. So I have made a little bit more detailed notes of them. Let's go through them one by one. So the first one says is spinous process. We'll go to the dorsal surface. This is known as the spinous process, the triangular spine, which is also known as spine of scapula. Now, if we go through the borders and surfaces, spine of scapula has 3 borders and 2 surfaces, out of which the posterior border is divided into 2 lips. Okay, the posterior border is also known as crest of spine. Okay, see, crest of spine. So it is divided into, the crest of spine or the posterior border is divided into 2 lips. One is upper lip, if you see this way, upper lip, and then your lower lip. Here we will have some muscle attachments. We will be studying them in the next video, in the muscle attachment video. Okay. So now, what is the importance of spinous processes? It divides the dorsal surface into 2 fossae. That is your supraspinous fossa, this one, and your infraspinous fossa. So that is all about spinous process. The next process is your acromion process. Okay, this one. Acromion process, if you see here. Acromion process has 2 borders. One is your medial border, present medially, and lateral border, present laterally. And then it has 2 surfaces, which is superior and inferior surface. That is superior surface and inferior surface. Okay, superior surface, inferior surface, medial border and lateral border. It also bears a facet where the clavicle attaches and articulates and forms the acromioclavicular joint of the shoulder joint. So the third and the last one is your coracoid process, which I already told means that it is a beak-like, crow beak-like structure, or also known as bent finger, right? It looks like a bent finger. So here I already told you, like a crow beak or bent finger. The another important thing that you can know about the coracoid process is atavistic type of epiphysis. Okay, see, usually people will not ask you that, but you can always increase and enhance your general knowledge. So, what is atavistic type of epiphysis is, see, actually phylogenetically it is an individual bone, okay, but after the evolution or after the development of the body, it fuses with other bones. See, what happens is the coracoid process is actually an individual bone. At first, genetically. Okay, you can't say genetically, phylogenetically. I hope all of you would be knowing about the osteology of the bones, how they begin to develop. If not, we can make a video for that too. So, for now, the coracoid process is actually an individual separate bone. But then, when it is developing with other bones, it gets fused. That is, it gets merged with some other bone or fused with some other bone. That is why this coracoid process is known as atavistic type of epiphysis. Okay, so that is all about the three processes of the scapula. So guys, we are done with the features of the scapula. Let's brush up fast. Come, let's revise along with me. So it has two surfaces, three borders, three angles and three processes. Okay, two surfaces are your costal or anterior surface, dorsal surface, which is divided into supraspinous and infraspinous fossa. Then we go for the angles. Superior angle, short and thin, medial angle, thinner than the lateral angle, and the lateral angle, which is rod-like and thick. Then the another thing is angles. It has three angles: superior angle, inferior angle, and the lateral angle, which is also known as glenoid angle. And at the last, we have three processes. That is your coracoid process, crow-like process. If we go dorsally, the spinous process that divides the dorsal surface into supraspinous and infraspinous fossa, and your acromion process. So hey people, that is all about the scapula features. We have already gone through the site determination of the scapula in the previous video. The link for that video as well would be in my description. Please check my description. Also, we are done with the features of scapula, and in the next video we would be learning about the attachments and clinical anatomy. Okay, I hope you liked this video and I hope it was of some help. And if there is any doubt, please let me know in the comment section below. So give this video a thumbs up if it was of some help, so that I can keep uploading videos. Also press the subscribe button if you haven't yet done that. Press the bell icon so that you get notified whenever my videos are uploaded. And stay safe, stay home. Safety is the most important. Thanks for watching. See you soon again in the next video.